If in the question they will mention about the CSF, that will have the increase of erythrocytes, low glucose level, hypotonia, depressed consciousness. So what will be there? There will be the intracranial hemorrhage. Okay, in hypocalcemia, what sign you will see in hypocalcemia? What sign you will see in hypocalcemia?
Trousseau sign and the Tiscott sign.
Yeah, so what is that?
And it's a kind of latent tetany that occurs when the calcium levels are low. So that there can be signs of seizures and.
So we have the signs of hypocalcemia. So if we say the sign of hypocalcemia, we have the two signs. What is these signs? We having the first sign, that is the Chave-Stokes sign, and we will be having the Trousseau signs. We are having the Trousseau signs. See, Chave-Stokes sign, basically we will see the facial muscle twitching. So we will see facial muscle twitching when you trap over the facial nerve. So there, that is known as Chave-Stokes sign. The Trousseau signs, when the carpal spasm, when you will inflate a BP cuff, when inflate BP cuff, so we will get the Trousseau signs. Okay, if in hypocalcemia, remember ECG findings, what you are going to see in the ECG finding, there is a prolonged QT interval. There is a prolonged QT interval seen in hypocalcemia. Along with that, you will see the decrease of BP will be there, cardiovascular, and the arrhythmia will be there. Calcium, due to calcium hypocalcemia, you can have the hair loss as well. Now the next question we will be having, the edema plus protein more than 3.5, hypoalbuminemia, hyperlipidemia. What will be there? That is which condition? Hello, are you sleeping? Everyone. So that is the nephrotic syndromes. Then we have the gluten-free diet. Gluten-free diet. Tell me about the gluten-free diet. What you know about the gluten-free diet? Which disease? Gluten-free diet. Which disorder?
Celiac disease.
That is celiac disease. So in what you will see in the celiac disease, that is the autoimmune disorders, where gluten will damage the small intestines. What foods to avoid? We have the BRO. B for bread, R for rye, O for oats, W for wheat. Okay.
Wheat.
Other than that, bread, pasta, cereals, any baked food made with the wheat, barley or rye. Okay. Beer also can be having. Most processed food, unless it is labeled as the gluten free. So all gluten free, like we have the BRO and some most processed food, but it should be written as the gluten free. That should be avoided. Sauce, soup, dressings that contain the wheat flour, that contain the malt, all these are they should be avoided. Okay. Then we have the examination first to clarify. Like this is the question of one of the urinary questions, urinary symptoms. We having one kind of a graphy, or we have the one investigation that we call the micturating urethrophy. In which condition we do the micturating urethrophy? If in the question you will see the which is the examination, you have to first to clarify. So in that condition you will do the micturating urethrophy. There is a one question you can see here. If in the question they will mention if VUQ, what is a VUQ? What is that? Posterior walls or the obstruction in the urethra. If any, there will be the VUQ posterior wall or obstruction in the urethra. What you are going to do? That is micturating urethrophy. There is also this is also known as the VCUG. What is the VCUG? That is voiding cystourethrophy. Voiding cystourethrophy. It is the fluorescing imaging testing when you used to visualize the bladder and urethra. You used to visualize the bladder and urethra during the urinations. ठीक है. And what is that? There is a vesico-urethral reflex, VUR, basically that is quadrant. If say that is a VU, vesico-urethral quadrant reflex. Posterior goals, any obstruction in urethra, for which is the first examination to clarify the any bladder or any urethra problem during the urination, we do the micturating urethrophy. If you see the blood in the urine, in the kidney stone, bladder stone, what you will do? You do the excretory urography. Which test you will do? Excretory urography will be done. If you see blood in urethra, hematuria, kidney stone, bladder stone, what you will do?
Excretory urography.
Excretory urography. If which examination is first to clarify, if in the question they mention first to clarify, then which one? Micturating urethrophy. Okay. Then question number, there is the point number 6, arthritis plus myocarditis. So what the diagnosis you will make with the help of that? If you have the patient having the some kind of arthritis, myocarditis, what you will make the diagnosis? Bolo. Tell us.
Juvenile rheumatic arthritis.
Juvenile rheumatoid arthritis. Okay. So in this question, you will see the patient will be having the juvenile age. The juvenile age patient having the arthritis, myocarditis. So you will see what that is juvenile rheumatoid arthritis. What are the symptoms you will see? In the juvenile, reduced mobility of the joints in the morning. You know there will be the morning stiffness. That is seen in which condition?
Rheumatoid arthritis.
Evening stiffness is seen in?
Evening.
Evening stiffness is seen in? Evening stiffness is seen in which condition? मैंने बोला क्या बोला, रूमेटोलॉजी के अंदर से 4-5 क्वेश्चन इजीली आएंगे. यू विल गेट 4 to 5 क्वेश्चन फ्रॉम द रूमेटोलॉजी. तो अच्छे से कर रहे हैं. स्टिल यू आर नॉट डूइंग.
Osteo में
osteoarthritis. ठीक है. So in osteoarthritis you will get the evening stiffness. In rheumatoid arthritis you will get the morning stiffness. ठीक है. Okay, tell me if there is a case of URTI, upper respiratory tract infection, the noisy respiration. Noisy respiration, you can say the stridor will be there. ठीक है. There is a stridor. The stridor will be there. Barking cough, that is seen in which condition?
Group stenosing.
So that is stenosing. What is another name of stenosing laryngobronchitis?
Group.
Yeah, group. ठीक है. And what other features you will see in this condition? बताओ.
Wheezing can be seen.
There is a sound stridor will be which stridor? Is a quick step. Okay. So what will be there? Just tell me. What you will see in the group?
Barking cough.
Barking cough. Other things? Sometimes you will see stenosing laryngotracheobronchitis. Sometimes you see the stenosing laryngotracheitis. Sometimes you see the stenosing laryngobronchitis. And so they all are the same things. Okay, this is the acute viral infection causing the URTI, upper respiratory tract obstruction, and this is common in the 6 months to 3 years. And what will the cause of that? What is the cause? Most common cause here. The most common cause is Bolo. Para-influenza virus, which is the most common cause? Para-influenza virus. And other is the respiratory syncytial virus, adenovirus, influenza. Then cut clinical features, barking cough. Why the noisy respiration? Because of inspiratory stridor. What other things you will see? The hoarseness of the voice, low grade fever. Symptoms often worsens at night. But symptoms often worsens at night times. That is stenosing laryngotracheitis. How you will make the diagnosis? By the clinically. X-ray, what you will see on an X-ray? What you will see?
Stipple
What you
sign.
will see on a stipple sign. Stipple sign is seen. Stipple sign is seen in Krok. Keep revising with me. Stipple sign is seen in which condition? That is stenosing laryngotracheitis. What is the stipple sign? Subglottic narrowing. क्या होगा? Subglottic narrowing होगा. What will happen? Subglottic narrowing will occur in stenosing laryngotracheitis. Then patient we have the meningococcemia. The BP is 30/0. Anuria condition. What is that? Meningococcemia related to the anuria. Whenever there is a urine output will be low, always think about what the patient is going to die. Means the patient is having the severe shock condition. The patient there is very poor prognosis will be there at that time. So if we will be having the meningococcemia, the BP is 30/0 anuria. So that is related to the toxic shock syndrome. The patient is going into the toxic shock. So tell me, if we have the meningococcus, we had seen that the meningococcemia, they will cause one disorders. What disorder is that? Hmm? Which disorder is that? Bolo, 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 bolo. Whenever you see the meningococcemia, you remember that is caused by our bacterial. So that is BP will be fall down. So if that will causing, if the BP is fall down, that's the sign of the shock. So this is what that the meningococcal septic shock with acute kidney injury. Why the acute kidney injury? Because of the anuria. Okay, that this indicating what? Septic shock with circulatory collapse, because there is a no diastolic pressure will be there, and this is the anuria is a sign of acute kidney failure, the sign of multi-organ dysfunction. Okay. Then we have the next one, that is the URTI plus cyanosis of the nasolabial triangle, percussion dullness in the lower lobe of right lung, mediastinal displacement to left. What will be there? What will be
Pleurisy.
here? Pleurisy. What is the pleurisy? Pleurisy. Inflammation of the
लेयर के अंदर.
Inflammation of membrane of lung.
pleurisy, basic pleuritis. We have the inflammation of the pleura, the lining of the lung. There will be the sharp chest pain will be there. That worsen with inspiration or coughing. Sharp chest pain worsening with inspiration or the coughing seen in pleuritis. What is the most common cause? The most common cause again viral infection. We'll see the sharp stabbing chest pain worsen with a deep breathing, cough or movement. Okay, and what you are going to see here, there will be the, along with that, see the pleural frictional rub. You see pleural frictional on auscultation. Pleural frictional rub on where? On auscultation you will see. And the patient will having the fever or dyspnea depending on the cause. What diagnosis? Clinical examination, chest x-ray, pleural ultrasounds will be there. So this is the main important thing. Then we have the stabbing, sharp chest pain will be there, that you have to remember. This will be the cyanosis because of the decreased oxygen supply. There is a cyanosis will be there, and you will see the dullness on percussion. The bronchiolitis, you see the moist trail, that you have to also remember. Bronchiolitis, what you will see, the moist trails will be there. Round bald spot plus hair fall at the length 5 to 6 mm. Petting a stray cat. What is that?
Microsporia.
Microsporia. Okay, so microsporia, it is also that is the tinea capitis. ठीक है?
कभी माइक्रोस्पोरिया में एप्टोस भी दिखते हैं ना, मतलब क्वेश्चन में आता है.
क्या दिखता है?
एप्टोस फॉर्मेशन.
मुझे समझ आ रहा है. Just write me textbook. So microsporia, we have the superficial fungal infection basically. So superficial fungal infection of which one? Of, see, this is what? Superficial fungal infection. Superficial fungal infection of what? Of skin, of hair or skull. And this is caused by microsporum species. This is caused by microsporum species. This is caused by microsporum, but it belongs to the dermatophytes. 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 Especially where the Microsporum canis, often from the cats or the dog. This is from the often from the stray cats, stray dogs, and highly contagious, especially where you will seen in basically in the children. You will see the round scaly red patches on skin. यहाँ पे लिख लो चलो देखो microsporia caused by microsporum canis मतलब cat dog. It is often from the by cat or dogs. ठीक है. What you will see or it is belongs to which category? By the dermatophytes. It belongs to the dermatophyte. Highly contagious. And usually seen in the children. What clinical features? There is a round, scaly, red patches on skin or scalp. Well-defined borders. They will be having the well-defined borders will be there. Hair loss in affected area. There will be the hair loss in affected area. You will see there will be the broken hairs. You will see or mild itching will be there. Broken hair or mild itching will be there. And there is a one diagnosis also. There is I think one question. So diagnosis you do the Wood's lamp. In Wood's lamp you see the fluorescent green. You use the fluorescent green under UV light. Okay, so we have the round scaly red patches on skin or well-defined borders. Hair loss in affected area will be there. That is the microsporia. So in this question, everything is clear to you. Round bald spot, hair fall at length 5 to 6 mm, patting is stray dog. So this is the microsporia. Alopecia areata. What you will see in alopecia areata? What you will see? Exclamation mark. Okay. This is an autoimmune non-scarring condition. Non-scarring hair loss. There is a no scar will be there. Well-defined patches, most commonly on the scalp. And what you will see, there will the exclamation marks will be seen. Okay. Then what you see in the tinea capitis, there is a coma here. Tinea capitis, what you will see, the coma here will be there. Next, the pulmonary mucoviscidosis. What is the mucoviscidosis? Another name of mucoviscidosis. Cystic fibrosis. Drumstick finger. Seen in which condition?
Mucoviscidosis.
Which pulmonary condition? Drumstick finger.
Bronchiectasis, yeah.
Bronchiectasis, you will see the drumstick fingers. Plus diagnosis, they already given the chronic pulmonary heart disorder. What examination you will do? This is related to the heart as well. So mucoviscidosis, you do the Doppler. Doppler means color echocardiography you will do. Okay, Doppler echocardiography will be done in this condition. Okay. In this microsporia, sometimes they will ask you which treatment you will give. So you can use the topical steroids. Like clobetasol. Topical steroids, or you can do the minoxidil as well. Topical steroids or minoxidil will be dosed in microsporia. Then we have the next question: dyspnea, skin and the foot edema, decrease in mornings. Okay, plus enlarged liver, systolic murmur. What is the cause of edema? Bolo. Samjho question ko. What the question is saying? Dyspnea plus we have the skin and foot edema.
Is it heart failure?
We have the enlarged liver. What?
Is it heart failure?
Yes, of course it's heart failure, but how it will be? I have not shared you the PDF yet. Revise with me. There was the dyspnea, we have the skin and the foot edema, that is decrease in the morning. We have the enlarged liver, systolic murmur. What is the cause of edema? So see, if you have the dyspnea, we have the skin and foot edema, hepatomegaly, enlarged liver is there, and systolic murmur. The likely diagnosis in this condition is what? That is the heart failure. Which heart failure? The right-sided heart failure, right side. And this will occur due to venous congestion. The venous congestion from right heart failure that will lead to the peripheral edema and congestive hepatomegaly. Okay. Then we have the shoulder rotation inwards. Shoulder inwards, elbow extended, forearm pronated. What will be the diagnosis? Tell me. There is a two condition, Abs-Duchenne palsy, and another one is Klumsky palsy. So what is the difference between them?
Abduction वेटर स्टिप पोजीशन में होता है डॉल्स आर्म C5 C6 का और
प्रोक्सिमल लिप्स होता है उसमें
क्या होता है उसमें बता दो प्लीज
C7 C8 की होती है नेक्स्ट क्लम की पैल्सी
स्लीपिंग और व्हाट
एबडक्शन और एक्सटेंशन दिखता है एल्बो में
So we having the Abs-Duchenne palsy. We have the that is the syndrome of upper brachial plexus injury. ठीक है. Klumsky palsy is the lower brachial plexus injury. So we having the Abs-Duchenne palsy, upper brachial plexus injury. We have the C5 or C6, and this is commonly caused by basically due to trauma during the birth. It's caused by trauma during birth. Okay, especially or usually in shoulder dystocia or excessive pulling during the delivery, you see the Abs-Duchenne palsy. What you will see in Vater's tip deformity. There will be the Vater's tip deformity, and C5, C6 will be lost. What you will see in the Klumsky palsy, the C8
and C9.
C8 and C9 भी होता है.
C7 C8
C8 and C9.
C9 होता है. C8 C9
C8
C8 and T1. ठीक है. C9 नहीं होता है. There is no C9. So Klumsky palsy C8 T1. So it's often caused by upward traction of the arms. It is often caused by upward traction of arm during birth. This is the less common than the Abs palsy. And remember this ones, it can also result from the trauma. What you will see here, that the claw hand. You will see the claw hand. Where is claw hand? Hyperextension of the finger, flexion of the wrist.
Claw hand presentation.
Large flaccid vesicles with purulent content plus rupture quickly. What is that? Where is the pemphigus?
neonatorium
Pemphigus neonatorium. What is that? This is the blisters disorders. Like some blisters will be there that caused by antibodies directed against which one? Desmoglin 3. Okay. We having the क्या था? Pemphigus neonatorum. Okay, this is the blisters formation, blistering disorder. There will be the auto antibodies against which one? Against desmoglin 3. Against desmoglin 3. Okay, this is the protein that involved in the cell-to-cell adhesion. Cell-to-cell adhesion. So there is a desmoglin 3. This is what autoimmune disorders. There is the autoimmune disorders. The antibodies form against the desmosomal proteins or the desmoglin 3. What you will see the clinical features? The clinical features you will see the blisters that rupture easily. blisters that rupture easily. So that is the main thing. So what you will see, that is related to erosions and crusting. Okay, this is commonly found the face, chest, diaper area, and it present with the fever, irritability, poor feeding. And the one another question they ask you, the diagnosis you can make with the help of clinical examination, or you can do with the help of Doppler, the direct immunofluorescence. Direct immunofluorescence. What it detect the IgG antibodies at epidermal basement membrane. Okay, the next one. We are having the large flaccid vesicles with a purulent content and ruptures quickly. The rupture quickly contributes neonatrums. Mother is RH negative, child is RH positive. Mother अगर negative हुई तो बच्चा RH तो क्या हुआ, नेगेटिविटी फैलेगी, तो RH incompatibility. If mother will be RH negative, there will be the RH incompatibility. If the mother will be positive, everything will be positive, no RH incompatibility. So for RH incompatibility, what test we will do? We do the Coombs test. Which test we will do? We will do the Coombs test. Then we have the rheumatic fever. The rheumatic fever, the treatment of the rheumatic fever, that's the prednisolone or benzathine penicillin. Everything I explained in the main lectures. The rheumatic fever, the profile axis, the penicillin, and the treatment we will use the prednisolones. And remember the duration of the penicillin as well. We have the fever 40 degrees Celsius, dullness on percussion over the lower lobe of right lung. That is the consolidation. Dullness or percussion means consolidated lung. Plus fever is also there. If you have the fever, consolidated lung, think about the pneumonia. Plus you have the abdomen normal. So this is the case of the pneumonia corpus. What is the treatment of pediatric pneumonia? What is the treatment of pediatric pneumonia? That is the Ampiox or Ampiox oxacillin or aminoglycosides. Ampiox oxacillin plus aminoglycosides will be the answer. Okay. A patient having the viral infection, the pain in the lumbar regions, plus we have the hematuria. The blood creatinine level is 0.18. Potassium is increased. So what is that? Blood creatinine. This is the normal range basically. So we have the potassium is increasing. So what is that condition? Acute interstitial nephritis. If the patient having the viral infection, pain in the lumbar region, hematuria will be there. That is the acute interstitial nephritis. Tell me what is acute interstitial nephritis? Tell me what is acute interstitial nephritis. We have discussed already. The inflammation of the renal interstitium, the tissue surrounding the renal tubules, and it is associated with the acute kidney injury. It's caused by? It is caused by
drugs or bacterial infections.
Drugs, bacterial infections, Streptococcus, Legionella, autoimmune disease, or the viral infection. Viral infection like Epstein-Barr virus, HIV, all they can cause acute interstitial nephritis. What you will see here, the acute onset of the renal dysfunctions, like we have the acute hematuria, the blood creatinine level will keep increasing, elevated serum creatinine level, so this is the that is start increasing basically. You will see the fever, the rashes, the pain in the joints, hematuria, the eosinophiluria means RBC cast in the urine, oliguria, anuria will be seen in the some cases or the severe cases. Okay, so all these are the some clinical features that you are seeing in the patient. Then after that we will be having indirect bilirubin is increased. If the indirect bilirubin is high, so what disorder? Hemolytic disease of the newborn, that is the icteric type. Okay, so we have seen that we having the jaundice. So we have the hemolytic jaundice. When will be the hemolytic jaundice? Which bilirubin will be high?
Indirect.
Conjugated.
Hepatic jaundice, we having the mixed conjugated and unconjugated. If you have the obstructive jaundice or the post hepatic jaundice, what will be high?
conjugated bilirubin.
Yeah, conjugated bilirubin will be high, or the direct, or we can say direct bilirubin. Conjugated or direct same, indirect or unconjugated same. The patient is having the segmental pneumonia, where see the respiratory rate is 80 per minute plus total cyanosis, the respiratory failure of the third degree. Can you just give me a quick summary of the respiratory failure? What are the respiratory failure degree? When we called it third degree, second degree, let's see.
जब साइनोसिस होगा तो थर्ड डिग्री होगी.
So basically we have the first degree. The first degree we will call it like we have the mild respiratory failure. When we see there is a mild dyspnea, symptoms, no symptoms. The second degree we will see there will be the partial pressure of oxygen. Here is 60 around 70. It start decreasing here, and the symptoms you will see the here you will see the mild dyspnea, and sometimes you see the no symptoms. But in second degree, you will see there will be the severe dyspnea will be there. Patient will be the restlessness, and there will be the confusion. Third, we will be having the third degree severe respiratory failure. That is the severe respiratory failure. The partial pressure of oxygen will be very less than 50 mmHg. And partial pressure of carbon dioxide will be significantly elevated. If we say the partial pressure of carbon dioxide, it will keep increasing. It will keep increasing. Here will be very high. Here will be less. Here will be more little high. And what you other things you will see here, that is the cyanosis. The patient will be the confusing, inability to speak in the full sentence, altered conscious, possibly life-threatening condition will be there. So in this patient, you have to start with the intubation, and if the moderate condition, you have to start with the CPAP BiPAP. You have to start on the CPAP BiPAP, but this requires intubation or intensive invasive ventilation or the supportive care will be required. They are the ICU patient. Sure. So we are having segmental pneumonia, respiratory rate is high, the total cyanosis means the respiratory failure of the third degree. Sulfur dimethoxy plus fever is 39 degrees Celsius. Maculopapular rashes are there. So what is that? What will be the diagnosis?
Measles.
Measles. What you tell about the measles? What you see about in the measles?
3 C's. Cough, coryza, conjunctivitis.
Cough, coryza, conjunctivitis. What other things you will see in that?
Spots.
Complex virus caused by SSRI virus.
So we are having the sulfur dimethoxins plus fever is there plus like this 30. So we have the fever and maculopapular rashes. So these are the sulfur dimethoxin, also known as the sulfadiazine. It's also known as the sulfadiazines. Okay, along with that, you will see the patient will be having the cough, the patient will be having the coryza, conjunctivitis will be there. So these all are the symptoms that you will see in these conditions. Okay, what there is a one cell also that will see in the measles. What is that? Okay, tell me, measles is caused by which virus?
SSRI virus.
That is paramyxovirus. That is the paramyxovirus. So we have the 3 stages I told you: prodromal, exanthum, or the prodromal phase is 3 to 4 days before the rash. You see the fever, cough, conjunctive coryza, or complex spot will be there. In exanthum phase, the rash phase, you see the maculopapular rashes will be there. Okay, the complex spot is the main feature. You see the maculopapular enlarged occipital lymph node. What is the answer? Enlarged occipital lymph node, we are having that is the rubella, and the rubella is ascending infection, measles is descending infection. Meningococcemia with infective toxic soap. Remember, pediatric meningitis. What the treatment you will give? Chloramphenicol succinate and prednisolone. What you will give? Chloramphenicol succinate and prednisolone will be given. Varicella plus mental confusions plus meningeal sign are negative. CSF is normal. What is that? See, CSF is normal. and meningeal sign are negative. Patient is having the varicella. The varicella, the most commonly it causes the encephalitis. So don't confuse with the meningitis and the encephalitis. Okay, tell me about the encephalitis. What is that? Encephalitis, the inflammation of the brain that is caused by the infections like the virus infection, that is the most common, and the most common we have that is the herpes simplex virus, that is the HSV. HSV, herpes simplex virus 1. That is the most common virus. And what the treatment? And after that we have the varicella zoster virus. What is the treatment in this condition in HSV1? What treatment you will give?
Acyclovir.
Acyclovir for the herpes simplex virus and varicella zoster virus. If that is not available, we can go for the valganciclovir. Valganciclovir is given in which condition? CMV basically. Cytomegalovirus, we will give the valganciclovir. The next one, with a minute bright red rash, mucous membrane is hyperemic, oropharynx, plus grayish patches on the tonsils. Submaxillary lymph nodes are in the grayish patches on tonsil. What does it mean? And with a minute bright red rash. Tell me firstly about the scarlet fever. So, scarlet fever is caused by which organism?
Group A Streptococcus.
Group A, gas by the GA. Group A, beta hemolytic streptococcus, and typically it following the pharyngeal infection. If you are having the strep throat, pharyngitis, and then it will after that it will be lead to the scarlet fever. Okay, which toxin they having? That is the erythrogenic toxin. Which toxin? Erythrogenic toxin that is responsible for the rashes. Erythrogenic toxin. There is a prodromal phase. Prodromal phase, you will see the fever, high grade fever will be there. Then you have the sore throat, that is due to pharyngitis. After that, you see the tonsillar exudate, white or yellow patches on the tonsils. Swollen lymph node will be there. Then we have the rashes phase. Rash phase will start 12 to 48 hours after the fever, and it will begin on the neck, chest, abdomen, then spread to the extremities. So it will be the centripetal or the centrifugal distributions. There will be the sandpaper like rash. Sandpaper like rash is the part of scarlet fever. That is minute bright red rash. That is the fine red sandpaper like blanching or erythematous. That is the minute bright red, the sandpaper like rash. We have the Pastia's line. Pastia line are what? Hanji?
Strawberry tongue.
Strawberry tongue. Mucous membrane is hyperemic. So that is the tongue appear red, swollen with a white coating initially, followed by the red papilla. Other than that, Pastia line. Pastia line will be dark red lines in the skin folds, where you will see elbow, armpit, groin region. What you will see? Pastia lines. Pastia lines. Then what other things you will see? The desquamation, peeling of the skin. Okay, along with that, you will see the submaxillary lymph nodes will be enlarged. Okay, so all these things we have already discussed in the main lectures. We have the diarrhea plus tenesmus. What is the tenesmus? What is the tenesmus? Batao. I already told you everything in main lectures. Frequent urge to go to bathroom means you have the sensation of incomplete emptying of the bowel and the bladder. This is the tenesmus, is the sensations like we were seeing. This is incomplete emptying of the bowel or any bladder. So okay, that is accompanied by the frequent urge to go to the bathroom. Then we have the diarrhea, tenesmus, sigmoid gut is tender and hard. So we have the diarrhea, tenesmus, sigmoid gut is tender. Sigmoid gut, large intestine is involved in the dysentery. Large intestine involved in the dysentery. Remember citylid. What do you remember? Citylid. Small intestine affected in the typhoid, large intestine affected in the dysentery, and sigmoid colon is a part of the large intestine. If you have the ulcerative defect and hemophilia positive, what you will give? Triple therapy. What triple therapy will be given? Omeprazole, trichofolum, and the clarithromycin. What is the trichofolum? The trichofolum is another name of metronidazole. Trichofolum is another name of metronidazole. Trichofolum is another name of metronidazole. Dun, 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 dun. Okay, so we have the omeprazole, trichofolum, clarithromycin. Also, omeprazole, trichofolum, clarithromycin. RH incompatibility. If the patient having a RH incompatibility and ABO incompatibility, what you will give? Replacing the blood transfusion means conservative therapy will be given. Number of teeth you have to calculate with the formula x minus 4. Number of the teeth you have to calculate with the formula x minus 4. Expected weight for 1 to 6 year old 2x plus 8. 6 month old only breastfeeding. At 6 month old 5 feeds will be given. 3 breastfeed, 2 biryani means 2 expressive feed. First month 7 feed, 3.5 month pay 6 feed will be given. Okay, first month old how many feeds will give? 7 feed will be given. 3.5 month old how many feeds will be given? 6 feed will be given. At 6 month we have the 5 feeds, 3 breastfeeding, exclusive breastfeeding, and the 2 we have the expressive feed. Okay. Start corrective feeding, fruit juice, expressive or the corrective feeding will be given at the 6 month old, but in one of the Krok question it's 4 month old. I think that is the mistake. So the expressive breastfeeding should be till the 6 month. There is nothing. Asthma plus wheezing, that is the epidermal. Asthma is what? Type 1 hypersensitivity. So this is the contact hypersensitivity, epidermal hypersensitivity. 3 rheumatic attacks, cause of the rheumatisms. Then what you will do? What the treatment? 3 rheumatic attacks, the course with the following rheumatisms. We have the prolonged treatment will be given. We have seen that the prophylaxis in the rheumatology video we have discussed the prophylaxis of the rheumatism. So we have to, if the having a severe rheumatism, acute rheumatic fever along with the carditis problem, you have to start with the prolonged treatment until 41 years. Heart failure with the diastolic pressure is the 0 mmHg. What will be the diagnosis? Heart failure with diastolic pressure. बताओ जी.
Aortic insufficiency.
Aortic insufficiency. Why the aortic insufficiency? What is the diastolic pressure? That is the pressure during the relaxation. Okay. So what will be the treatment? See, what will be the condition? The patient is heart failure. The diastolic pressure means basically, of course, it is a life-threatening condition. This is suggest as the cardiogenic shock. Okay, where you will see that whenever the diastolic pressure is 0 means the heart is not able to relax. As the heart is not able to relax, there will be the aortic insufficiency will be there. Okay, there are lots of other things will be there like the restrictive cardiomyopathy, hypertrophic obstructive cardiomyopathy can also be there. But according to the options, this is the best answer, that the aortic insufficiency. Then when nutrient ulcer disease of the stomach, that according to the Krok, it is the interstitial bacillus. Otherwise, it can be the Haemophilus. No, yeah. Otherwise, the answer will be there. That is, yeah, that is the Haemophilus influenzae. Okay, answer. If this is the intestinal bacillus according to plus, otherwise Haemophilus influenzae will be the answer. The nutrient must not be limited in the acute glomerulonephritis. That nutrient must not be limiting in the acute glomerulonephritis. That is the carbohydrate. Percussion sound shortened in the right intrascapular regions. That X-ray you see the segmented infiltration. So what is that? So here you will see the one segment is affected. So if one segment is affected, that is what we are having the segmentary pneumonia. The abdominal pain after the fried food. The abdominal after the fried food plus pain in the sera point. Pain in the sera point. What is the same? What will be the treatment? What will be the diagnosis? बताओ. Tell us what is the sera point. I told you. What is 0 point? अरे पढ़ते ही नहीं बिल्कुल भी. Then you have the 5 days old BCG vaccine in mg. How much dose? 0.05 mg dose will be given. Patient chronic sinusitis, right-sided cardiac sellout. What is that? Carter-Jenner syndrome. That is the Carter-Jenner syndrome. What is Carter-Jenner syndrome?
ऑटोसोमल रिसेसिव जेनेटिक डिसऑर्डर होता है, टाइप ऑफ प्राइमरी सीलियरी डिस्किनेसिया.
Primary say what other symptoms you will see?
Situs inversus.
Chronic sinusitis, right-sided cardiac sellout, or we call this the situs inversus. Along with that, what you will see, the patient will be having bronchoectasis. Okay, and it is the type of primary ciliary dyskinesia, where you see the cilia in the respiratory tract or other parts of the body will not work. It is which condition? It is the autosomal recessive condition. Then what is which mutation in which gene? In the dynein arm of the cilia. In the dynein arm of the cilia will be defect. The cilia will become immotile. Okay, remember chronic sinusitis, situs inversus, and the bronchoectasis will be there. Okay. What other features are associated with Carter-Jenner syndrome? It is associated with the infertility, it is associated with the hearing loss, it is associated with the frequent respiratory infections. Okay. Next second. We have the polyhydramnios. What is the polyhydramnios? Yeah. What is polyhydramnios? Plus choking plus cyanosis with the first. So that is what. Okay, that is the case of the first feed. So that is the cyanosis with the first feed. What will be there? Esophageal esophageal atresia. So tell me what is the esophageal atresia basically?
Esophagus does not directly connect to the stomach.
So that is the esophagus not directly connected to the stomach. So what is the polyhydramnios? Excessive amniotic
fluid.
Okay, so excessive amniotic flow during the pregnancy. So patient will be having the encephaly. This is the most common cause, the fetal cause. In the fetal, if you have the polyhydramniosis, the choking, so they can lead to the anencephaly. It can lead to the esophageal or the duodenal atresia, the impaired fetal swallowing. Okay, other etiology possible with it is that neuromuscular disorders, twin-to-twin transfusion syndromes, and a fetal anemia like RH isoimmunization. Okay, the maternal cause of polyhydramnios is what? Diabetes mellitus and the infections like the torch. Okay, the esophageal atresia, it is one of the common. It is one of the cause of what? Polyhydramnios. What other cause I told? Anencephaly. Then second one I told esophageal atresia or the duodenal atresia. Some neuromuscular disorder, the twin-to-transfusion syndrome, fetal anemia. They all are the fetal cause of polyhydramnios. The maternal cause of polyhydramnios is what? Diabetes mellitus and the infections like the torch. Okay, understood? Okay, good. Hemolytic disease due to RH incompatibility. What you will do? Exchange the blood transfusion. Child diagnosed with the foreign body in the right bronchus. Child diagnosed with the foreign body in the right bronchus. What will happen? The atelectasis, the lung collapse will occur. The complication. Road accident, minimum % blood volume result in the death. The minimum percentage of blood volume result in death. What is the minimum percentage? That is 25 to 30% blood loss patient can lead to the death. Conjunctivitis on third day of the life lasted for the 2 weeks plus tachypnea, bilateral inspiratory crackles, bilateral pneumonia plus no history of the fever. देखो, there is a conjunctivitis. There were the conjunctivitis on the third day of the life, lasted for the 2 weeks. Tachypnea plus bilateral inspiratory crackles, bilateral pneumonia plus no history of the fevers. That is what chlamydia trachomatis. That is the chlamydia trachomatis. Okay, I told you that the conjunctivitis it's caused by the conjunctivitis we have discussed in detail, right? It can be the bacterial. What is the conjunctivitis? Basically, first of all, inflammation of the conjunctiva. So it can be the viral conjunctivitis, it can be the bacterial neonatal conjunctivitis, and or all these things are possible. So if you have the viral conjunctivitis, what is the most common cause is that the adenovirus. That is the adenovirus, where you will see the watery discharge. Bacterial conjunctivitis, the cause is staph aureus, staph pneumonia. You will see the purulent discharge. The bacterial purulent will be there. Then it can be due to some kind of the allergy also. The allergy will cause what? Allergy due to like pollen, dust, itching will be there. Okay, so there will be the, and it will be due to neonatal
Chemical.
also. Yeah, due to chemical also, and one more is neonatal. So neonatal is known as the ophthalmia neonatorum. That is known as the ophthalmia neonatorums, and it's usually seen in the 0 to 5 days by the gonorrhea and 5 to 14 days by the chlamydia trachomatis. So that is the neonatal conjunctivitis. That is the ophthalmia neonatorum. Next can be the gonorrhea. The gonorrhea, it lasted from 0 to 5 days. When if we having the chlamydia, it is from 5 to 14 days. So it is usually 2 weeks. Okay, so we will be having the lasted for the 2 weeks. So this is the best chlamydia trachomatis. Okay, with the redness, water discharge, grittiness, or the foreign body sensation. Photophobia, sometimes the patient will be having the tearing. If what the treatment will be given, erythromycin or tetracycline eye ointment. Tetracycline eye ointment at birth. Coughing and wheezing plus expiratory wheezing. Whenever there is wheezing during the expiration, this is because of obstructive. So this is asthma throughout all the lungs filled. So that is the subcutaneous. What treatment will be given? Subcutaneous epinephrine will be given in patient with the asthma or having the some kind of the after some kind of the expiratory wheezings. The child passes a blood meconium stool. The diagnosis procedure performed first. Which procedure? Take a blood meconium stool. What you will do? The initial blood investigation that you are going to do here, that is the barium enema. The baby covered with the pea soup amniotic fluid. That is first step in the resuscitation, the suction of the trachea. What is the pea soup amniotic fluid? Pea soup amniotic fluid. Bolo. Simple one. Pea soup amniotic fluid. Kriti.
मिकोनियम के वजह से होता है.
तो बोलो ना. So that the greenish thick, the greenish fluids often indicate that is meconium stained amniotic fluid. So that is because of the meconium. Okay. So we have the fetal passage of the meconium. That is the first stool into the amniotic fluid before or during the labor. So that is what we have in the pea soup amniotic fluid. So what you have to do? You have to suction trachea under the direct supervision. Okay. Because it can lead to the fetal hypoxia or the asphyxia, and there is a risk of meconium aspiration syndrome that will lead to the respiratory distress, pneumonitis, or airway obstruction. So this is the best things that you have the immediate neonatal suctioning or resuscitate the support if baby is not rigorous at the birth. And if still, this is the first step. After that, if still baby is having some kind of the respiratory distress, then you have to check about the NICU care in the nursery. You have to take the baby to the NICU and ICU, and then check about the sign of meconium aspiration syndrome. Newborn infant, mild cyanosis, cardiomegaly. Heart rate is 230. Heart rate 230. Newborn is there, mild cyanosis, proximal atrial tachycardia. Just watch cardiology, both part 1 and part 2. And your whole cardiology will be finished till basic to advanced level. Like not so much advanced level, but like from basic to intermediate level, if I say, that will be very, very clear to you. The cardiology part 1 and part 2, just watch both the videos. And all the questions from the cardiology, you will be able to do it. What will the student do? What aldosterone do? Swati, what aldosterone do?
सोडियम की
नहीं बताओ तो कृति.
वो सोडियम की रीअब्जॉर्प्शन कराती है और पोटेशियम को बाहर निकालती है.
So sodium retention and potassium excretion. So what is in this question? In the question, sodium is decreasing and potassium is increasing. Opposite, उल्टा हो रहा है ना. तो क्या होगा? क्या होगा? Hyperplasia. Sodium decreasing, potassium increasing, congenital adrenal hyperplasia. Crampy abdominal pain, rash, proteinuria, microhematuria. What is that? Anaphylactoid purpura, HSPA. There is a 4 things we have discussed: vasculitis, crampy abdominal pain, the rashes are there, and we have the purpuric rashes, proteinuria, microhematuria. That is inox colon purpura. And what are another name? Anaphylactoid purpura. Finding in primary tuberculosis. What are the findings? Hilar or paratracheal lymph node enlargement will be there. Pain in suprapubic area plus painful urination. What will be there? Suprapubic area, the pain in the suprapubic area, cystitis. Butterfly rashes seen in bolo,
SLE,
SLE.
systemic lupus.
Wire loop kidney seen in which condition?
SLE.
Wire loop kidney. One form of the SLE. What is that? Lupus
Nephritis.
nephritis. Common cold at night plus inspiratory stridor, barking cough, group. Hyperbilirubinemia, later converting primitive reflex. So plus we have the setting sun eye sign seen in Kernicterus. There is a convulsive primitive reflex. So this is the having some convulsion, means neurological problems are there. So this is the encephalopathy due to hyperbilirubinemia. More bilirubins that cause Kernicterus. Kernicterus means jaundice on brain. We have the like more hyperbilirubinemia in brain. So that is bilirubin level increase in the brain. So that is the causing Kernicterus. So if they are having the hyperbilirubinemia or Kernicterus are there, that is causing the encephalopathy due to hyperbilirubin. Obstructive inspiration plus parainfluenza. The same question. Inspiratory stridor. What will be there? Acute laryngotracheitis. Admit to the hospital. Ficus of the ostealgia plus body temperature 39 degrees Celsius. Lymphocyte 87%. Examination. What you will do? Sternal puncture will be done. Sternal puncture will be done. Shoulder turn inwards, elbow flex, forearm pronounced. So what is that? Avs palsy. We have discussed this. Then skin pallor, acyanosis, continuous systolic murmur to the left of the bone plus murmur on whole cardiac regions to the back. What is that? Murmur on the whole cardiac regions to the back. What is the defect of interventricular septum? Defect of interventricular septum. This is the question because we have the acyanotic disorders. The acyanotic disorders, we will be having the VSD, ventricular septal defect. That is the VSD, interventricular septum or the ventricular septal defect, due to which we see the continuous systolic murmur. देखो, continuous systolic murmur or continuous or machine-like murmur will be seen in the defect in the interventricular septum defect. For prolongation it for the 10 days. This is the hygiene question. ठीक है, just For prolongation, if you have the 10 days, just you can take the sign of the doctor. But if you have to prolong the leave for more than 10 days, you have the doctor in charge of case together with the HOD will take the action to take sign for the more than 10 days leave. Okay, so HOD will be there for more than 10 days. Atopic dermatitis exacerbations, use of the neutral creams plus protect the skin. This is the case of atopic dermatitis. Chicken pox rash plus low grade lymphocytic plus increased protein. So this is the H. We will discuss it later on. That is herpes zoster virus varicella zoster that is causing the encephalitis. Okay, the in rest we will discuss in the next video. Okay.